Good afternoon, everybody. This is Dr. Lanny Izzo in the ongoing series of Getting to the Point. I've been speaking about energy medicine, and specifically in the last couple of videos, I've been honing in and focusing on children's health. I am developing a library, a video library, specifically for Sana Vita Healing and Cleansing Center in New York City, right off of Union Square. We are developing Sana Vita Kids. It is a program of natural health care to take care of our kids, take care of our children. There's a huge community down in that area, and it's a young community, and it's a community that I believe has not been well serviced relative to natural health care for children. The connection I have is with Gabriel Hoffman and Arul Goldman, and we've been developing this conceptually and through our vision, and we're putting it into action. If you're hearing this video, it's probably already past our first teleconference, but you can go to sanavitakids.org and there'll be a recording of our first teleconference, which is entitled "What Your Doctor is Not Telling You About Your Children's Health Crisis." So this video is specific. It's not just for children, but you'll see the importance of knowing this information if you're a parent and or if you are anyone who's working with any kind of health issue. What I want to talk about specifically here is why not to use antibiotics. Now, there are reasons to use antibiotics, and there are more reasons why not to use antibiotics. And if you're not going to use an antibiotic in treating your children's symptoms, then it makes sense to have an alternative to that. And I'm not suggesting at this point that you just blindly choose not to use antibiotics. Our children, our two children who are no longer children but adults, Alex 31 and Daniel 26, they didn't grow up with any antibiotic use. They weren't vaccinated, they didn't take antibiotics through their life, and they're both quite healthy. As a matter of fact, their immune system, I guarantee, is stronger than most anyone out there. And there are reasons, or there are factors that strengthen an immune system. Antibiotics is one of the key factors that really diminishes the strength of immune function, and many parents are waking up to this and many parents aren't. As an energy practitioner, I have used energy medicine technology for 34 years, whether it be the energy technology of my hands and my own consciousness, my own awareness, or the energy technology of the sensitive imago that I use now, which we can really see into the deeper recesses of the body, and we can see and become aware of where the body is holding toxic burdens or burdens that have to do with environmental issues or chronic bacteria, chronic viral, chronic pathogenic infections that are still in the body. And a person still might not be aware of them. They might not be symptomatic, but the body is holding them, either bacterial, fungal, viral, or parasitic. And that's what I want to talk about right now, and I want to hone in on bacterial infections and what happens when we treat it with an antibiotic. Now, what I'm about to show you is not well understood. It is not understood in the conventional model, and even outside the conventional model, there are many natural practitioners that don't understand what I'm about to show you. Those that do are those that have a background in a field called homotoxicology. Those have a background in dark field microscopy. Those who have some background with microbiology from more of an esoteric viewpoint and understand how the microorganisms pleomorph or change shape and mutate. Medical science is just beginning to kind of acknowledge that, and there's some information that's out there, that understands that the crisis we face today, particularly around, the resistant bacterial strains, the antibiotic resistant strains that we are now faced with because of the overuse of drugs for the last 70 years or since the late 40s. What is being recognized is that there are resistant strains of bacterial organisms that are developing because they have pleomorphed or they have evolved. They are intelligent little beings. They are intelligent little microorganisms. They're not just going to sit there and get their butts kicked through the perfect drugs. Nature is always evolving. Bacteria is part of nature. Bacteria will always be evolving. All microorganisms will evolve according to the conditions and according to the influences that are being put upon them by our assault upon them. And also they will evolve because they're part of evolution. One of the hallmark concepts of 21st century functional medicine, not conventional, functional. Functional medicine is a field of medicine that understands the multidimensional facets of medicine, that healing the body is a multidimensional approach if we're to do it holistically and do it more effectively. And within that holistic approach, we want to look at the entire body and understand how the body functions in health, not just in disease. And how we function in health, to me, makes a lot of sense. If you understand how the body functions in health, then I believe we will have a different approach to treating disease, because we will understand that maintaining the body in a healthy state is far more cost effective, far more health effective, far more proactive in helping an individual heal, develop, and live a healthy, prosperous, and lucrative life relative to generating what they came here to generate in terms of their life experience. Drugs have a benefit, but drugs, principally pharmaceuticals, are basically a suppressive approach to treating symptoms. I will say this again. Medication, specifically antibiotics, is based in a suppressive approach to treating symptoms. It does not heal the underlying conditions. And over the many years that I have had the privilege of being introduced to energy medicine and understanding the scope of awareness that energy medicine opens up to a practitioner, and respecting the clinical part that energy medicine plays, I have been able to observe individuals that come in to see me that on the surface don't have any specific symptom going on that would warrant an antibiotic in that moment. But in my questioning with them, I would find out and discover that they, like many individuals through their lifetime, have had copious amounts of antibiotics. And we're not even talking about the antibiotics that are in our foods. We're talking about antibiotics that have been provided through the conventional model. We abuse antibiotics in our culture, and it's not easing up. And one reason we do it is the lack of understanding of what I'm going to show you. The other reason is because it's the tool of choice. The industry, the medical industry, is basically directed and governed and controlled by pharmaceuticals, so antibiotics are never going to go away. And I am not discounting the right use of antibiotics. I am looking at helping parents in particular understand what you are risking when you just put your child on an antibiotic and think because the symptoms go away that the problem's going to go away. So what I drew here was these three levels that represent 3 levels of the body. You have the blood, and what you have here is the outer environment. So this is the blood supply. And then the blood supply, if you go deeper into the body, is part of what we call this internal matrix. And it's in this matrix that those of us that practice homotoxicology or functional medicine, and this is very well known more in European biology or medical biology than it is in our Western world, that the matrix is all that organized function, from hormone function, where it intersects with blood flow, with lymphatics, with all of the immune function, very much is centered right here in the matrix, and all this control is extended into the blood. And what is part of the matrix is where the cells, the connective tissue, the cells, and the organs and the systems really reside. So all function is contained in all of this tissue, the majority of the tissue of the human body. The majority of the tissue is not the outer layer. It's all of this, the internal tissue with all of the function, and it's very complex, and it's very amazing. I want to keep it simple, and I've often said that 21st century medicine is really based on common sense, so I want this to appeal to your common sense. When we get a fever, which is a symptom, right, any kind of fever, the tragedy in today's conventional model is we have become terrified of fever. And you can give a lot of rational reasons to be terrified of fever. You give one reason to a parent, and that sets the stage for inappropriate treatment for the remainder of that child's life. The one rational reason is, well, you know, you don't want your child to get a fever, they might have a seizure. Where that started. And that's not to say that high fever cannot lead to seizure, but right now, not having a fever, the baseline, the knee-jerk reaction to determine giving an antibiotic is you don't want your child to have a high fever. When I was growing up, and my generation was really probably the last generation to not be afraid of fever. My dad wasn't afraid of fever. My parents weren't afraid of us to have fever. Fever was treated through, back then, my dad would use these cold compresses and use alcohol compresses to cool the body down in strategic parts of the body. I don't recommend alcohol compresses anymore, but I recommend cold compresses, and I'll show you what you can do at the end of this video for your child. There are a number of things you could do naturally. So we've developed this knee-jerk reaction that fever is no good, and I've seen children come in to see me in the first month of life that already have been on Motrin, an anti-inflammatory, damaging their liver, damaging and influencing their immune system in a way that is not even considered, simply because the overriding purpose is to eliminate fever. And we're not just talking about any fever. We're talking about just about all fever. Right now there is such a phobia to fever when it comes to pediatric care and adolescent care. And it is harmful to your child for you to go through your life being terrified by fever. And I've seen many mothers that are terrified by fever. And that is a crooked way to think. It is not in balance with nature. Now, I am not saying that fever is not something you shouldn't be concerned about, but fever is something we want to be an ally with. Fever is not your child's enemy. It is controlling that fever and controlling the process that's under that fever. So as soon as we get symptoms, and fever is not the only type, redness in the ears, immediately by most pediatricians assumed to be infection. Antibiotic. Sniffles, infection. Antibiotic. Flu-like symptoms, infection. Antibiotic. Inflammation of the lungs, symptoms, antibiotic. many pediatricians, and I have many friends that are pediatricians over the years, and I empathize with them, because if that's the only tool in your toolbox and you're a terrified parent almost demanding that you do something, the script is the easy approach and symptoms will be resolved, but the issue won't be resolved. And research has come out and shown that even antibiotic use resolving symptoms is not too much better than doing nothing. Those symptoms more often than not would resolve anyway. So when do you make that determining factor? That is not just up to the pediatrician, but it's also up to the informed parent who does not panic at the sign of symptoms. Symptoms is nature's way of communicating to you that your child is looking to go through an immune purification. Your child's immune system is looking to be strengthened. They're not just under an assault where the child is just helplessly there, and the only way out of this crisis is to bring in the heavy artillery. And let's do it over and over and over and over again. I have had children come to me over the years in their 10th, 11th, 12th year of life, and they have already been on 40, 50, 60 rounds of antibiotics. I've had individuals come to me in their early 20s with major autoimmune issues that have been over 100 rounds of antibiotics. I've had 6- and 7-year-olds that have been on 30 rounds of antibiotics, very common. 2-year-olds that have been on a couple of dozen rounds of antibiotics. 1-year-old that's been on 3, 4, 5 rounds in the first year. Not uncommon. Even a 1-year-old that's been on 2 rounds of antibiotics. You've got to start thinking and questioning what's going on. Do not just go along with that knee-jerk reaction. Now here's what happens. And this is not just a theory. This is what has been understood in the area of how microorganisms pleomorph, how they will mutate, and how they will go through survival. Because all of nature looks to survive. A person will only get a symptom. Your child will only get a symptom, whether it be fever or any of the other symptoms, when the bacteria is in that blood. And it's in the blood that the body can do battle with it. The body wants to do battle with the bacteria in the blood. This is why healthy blood, pure blood, healthy immune system. We want to do battle in the blood, and fever is part of the way that the body battles. Now, when you have a healthy immune system, you can have a healthy fever. And a healthy fever is a short-term battle. It's over. You're not lingering. You're not stuck in that fever. You're not in a spiking fever where the body spikes but it can't hold it. And there are other levels that are assaulting the immune system besides bacteria that are just not seen to the eye of the conventional doctor. But let's look at what happens when a bacteria is in the blood and a child gets a fever or a symptom. We introduce the antibiotic, which ultimately gets into the blood, and it will destroy bacteria that's in the blood, and so symptoms will start to resolve. But what will also happen is a large part of the community of bacteria they won't just stay there and get their butts kicked by the assault of this antibiotic. They will migrate out of the blood and go into the tissue. They'll leave the blood and find a way to filtrate into this connective tissue, or this matrix where all function is controlled. And what will happen then is, after the siege of antibiotics is over, you see these bacteria come back to the surface, particularly if these are pathogens, if these are pathogens to the body, if they are not bacteria that the body supports, or if they are bacteria that the body doesn't support. And what we're finding out is that many strains of bacteria that we have treated are really not just opportunistic to infection, but a part of the body's healing response for infection. And that's a topic for another video. So many of the bacterial infections that we've been treating is nature's way of looking to resolve an issue of toxicity and immune system dysfunction. And we've been taking away some of nature's evolutionary movements to help the immune system, particularly in the 21st century. This is not understood. So let's just look at what happens when you have a strep or a staph, in the particularly strep. I see strep a lot. When you have a strep infection, or any of the dozens upon dozens of different type of bacterial infections that are going on non-identified, just treated with broad spectrum bacteria. The bacteria, some of it will be destroyed, most of it will move out of the blood into the connective tissue. If that bacteria is a pathogen, the body and the intelligence of the matrix, the connective tissue, will say, don't hang out here, we're going to move you back up into the blood. Goes back into the blood, symptoms return a month later, 2 months later, every couple of months, every season, whatever it might be, and symptoms return. It's the body's immune system trying to muster an assault to deal with this naturally. We are afraid of symptoms. We have a knee-jerk reaction to symptoms. We are terrified of symptoms. We reach for the only tool in the toolbox, the only tool in the conventional toolbox. Let's treat it with antibiotics again. And we push it back down. We might resolve the symptoms, which are going to resolve more than likely anyway within 48 hours or 72 hours. And when this pattern is repeated, what will happen is you will develop a community of bacteria that start to live in that deeper connective tissue. And I became aware of this in the 90s, and I was taught this principle, and now I've seen it in action for over 20 years. And when you have an energy medicine and energy technology lens that can actually measure the frequencies that's in the connective tissue, and the connective tissue, remember I said, governs all function. It's what's going on here that's causing autoimmune issues. And when you keep pushing down bacteria, or you take a virus, the virus will work the same way, or you take fungal issues. Many symptoms are due to yeast, overgrowth, fungal issues that migrate into the blood. For the body to handle it, the body is too overwhelmed, the immune system is not equipped to. The liver, as a means of detoxification, can't handle it. The systems of elimination, which is the skin, the lungs, the bowels, can't handle it. The kidneys can't handle it. So now you have skin issues, you have lung issues, you have kidney issues, you have bowel issues, and you have this matrix which is full of contamination from viruses, fungal issues, parasites, bacteria that keeps getting repressed due to the repressive nature of pharmacology and drugs. And lo and behold, what happens is you have the crisis that's building under the surface. And this is what leads to chronic disease right here, because we cannot do the battle in the blood. And we have created a sterile community of children, our society. This is what happens in hospitals. And the more we go forward with the greater sophistication of creating the next drug to handle the next resistant bacterial resistant strain, the more we become sophisticated, the more sterile our immune system becomes, the more impotent our immune system becomes to the very environment that we have created. You've heard me say, or maybe you haven't, we've created an environment that we can no longer live in outside of ourselves, and now that environment is living in us. This process of elements that are in the blood where the immune system can effectively work with them, and it doesn't mean the immune system can't work with them here, but it works with them more effectively in the blood. And there's a blood supply through here as well. But once they're here, that's where the body's ready to battle with it. We can look at any toxin, fungicide, herbicide, environmental metals, anything that the body needs to get rid of. It needs to get rid of it through the circulation and with the help of the liver and the bowels and the lungs and the kidneys. So the more that we push our bacteria down, the more you build a community that starts to live outside of the awareness of conventional medicine, because they're not going to see it in the blood. And the more you push it down, the greater the inflammatory response that develops here. And this is the basis of all autoimmune issues, all chronic inflammatory issues. And this is not going to be seen clearly in the conventional model. They just don't go there. And we have ways of clearing this. And what happens in a more chronic state is that as we continue to use suppressive means of treating symptoms, we ultimately push down the invading organisms so they start to infect and infiltrate our organs and then our cells. And then once in the organs and then the cells of the organs, then they'll infiltrate the cell itself. And once in the cell, it becomes part of the cell environment. And then once it becomes part of the cell environment, it can infiltrate into the nucleus of the cell. And here's where you have cancer processes that begin, right here. You have neoplasmic processes that begin where the DNA starts to be infiltrated because of what's come from the environment, because of what was never cleared or purified in the blood, because of what begins to live in the matrix and continues to be suppressed by a faulty immune system, where the immune system can't even recognize what's there anymore. It's become, the immune system adapts to these toxic elements that can no longer serve the body. They don't serve the body, the natural design of the body. And then if it's pushed deep enough into the cells, the organs, and the cells of the organs, then you begin to have organ function change. And this is a pathway of disease. This is one way of describing exactly what happens. It gets a little bit more complex than this. There's an energetic component that overlays all of this. So the energy, you know, the energy field that extends beyond the body registers all of this. And when we can look through the energy field, we can begin to see. We can see quite clearly. With my work with the sensitive imago, I can identify past infections that are stuck, that are now contained within the organs, within the cells, within the matrix, that are breaking the body down. And very often, and here, friends, is a key concept to understand, and I'm going to end on this, and we'll continue in another video. Much of the time, when the body starts to adapt to this level of contamination and toxicity, whether it be from a pathogen or an environmental toxin, when the body is holding this and the immune system stops reacting to it, so there are no symptoms, that's when a person is in danger, because you don't know what's breaking you down. And all of a sudden, boom, there's the crisis. You know, I don't know, he was never sick a day in his life. You know, all of a sudden it just came on. All of a sudden, all of a sudden. It's never all of a sudden. It is an insidious process, and only insidious because we don't recognize really the true nature of how bacteria work in the body, the ability of a bacteria to pleomorph, change its shape, to evolve, to become not only resistant to the drugs that we're putting in ourselves and in our environment, but they also pleomorph into mutations of what they once were. And this is going on right now in the immune system, going on a lot in the gut. And gut function, understanding gut function today is a key to understanding all of this. So I trust this was not too confusing. You might have to look at it a couple of times. Common sense-wise, this is how it happens. And common sense-wise, doesn't it make sense to begin to understand that fever is our ally and not our enemy, and help nature meet the assault that has been self-created upon us based on our own living and our dissociation from nature and from the environment. The only way it's going to change is we change and start to come back to a natural cure. And what we're doing at Santa Vita and the program of SV Kids is looking to help parents become more proactive wellness warriors for their kids. Become a wellness warrior for your kid, for your child, and for yourself, and you will change the course of the direction of your child's future without a doubt. Getting them on a straight path, develop healthy immunity, and there is so much more to healthy immunity today. The relationship of the immune system to our emotions, to our thoughts, to brain chemistry, to how we evolve as a species of people. We have been suppressing our natural expression for being whole for so many years, and this is what's changing just at the very beginning of the 21st century. So this is Dr. Lenny Izzo, signing off from certainly SV Kids. Go to our website, santavita.org, and check us out. Look at my website at lennyizzo.com. Check my blogs. I'll put this on a video blog with a little explanation about it. And by all means, join us at any of our teleconference calls that we'll be doing at least once a month through Santa Vita. So bless you on your journey. Be an advocate and a warrior for your child, and we'll see you next time. This is Lenny Izzo saying goodbye for now.